Welcome to Life Talk with Mariette. I am Mariette. This show is about the life lessons that shape us, what I've learned, what I'm still learning, and how we grow through challenge, awareness, and purpose. I will share personal insights to motivate and inspire you, and sometimes invite guests who do the same. At its heart, Life Talk is about real stories, real growth, and meaningful connection. This is Life Talk with Mariette. Motivational, inspirational, full of heart. Enjoy the show. Hello and welcome to Life Talk with Mariette. I'm your host, Mariette Cameron. Yesterday, somewhere in America, someone's life changed forever. A phone rang. Your father fell. One sentence, one moment. Suddenly, nothing else mattered. Work didn't matter. Dinner plans didn't matter. The meeting scheduled for tomorrow didn't matter. Only one question mattered. What do we do now? The truth is, thousands of families receive that phone call every single day. But today's program isn't about preparing for the phone call. It's about preparing before it ever comes. Welcome to Care Inside with Al Criscolo, president and owner of Executive Home Care in Stratford, Connecticut. On the web, executivehomecare.com/Stratford/. Welcome to Life Talk, and here's Al Criscolo. Al, how are you?
I'm doing well, Mariette, and thank you for the invite and the attendance for the show today.
It's great to have you. You tuned in to Life Talk with Mariette. I'm your host, Mariette Cameron. So let's get started. In today's show, we're covering when adult children become the parents, why waiting until a crisis makes everything harder, choosing a home care agency, and the greatest gift you can give to your family. And we're talking to Al Criscolo, president and owner of Executive Home Care of Stratford, Connecticut. So let's get started with segment one. When adult children become the parents. I think one of the biggest surprises in life is that no one prepares us for the day when the people who took care of us begin needing us to take care of them. It doesn't usually happen overnight. It happens little by little. Today, I would like us to talk about the journey because I think millions of families are either living it now or will someday. So here, I prepared a lot of questions for you, Al. We're going to be really doing, in 1 hour, great workout you're going to have. So here's our first question. Al, when you think back over all the families you've helped, does this usually begin with one major event, or does it start with little things that almost go unnoticed?
You know, Mariette, it has a tremendous amount of complex to that question, but usually the phone call rings because of an event, and it's usually a single event that occurs that now precipitates into what do we do now as the family, and what do we foresee happening in the future. So there are situations where this could be the nth time that they've had to deal with a situation, or it could be the first event where mom or dad, family member, has now had a situation happen. So it does get complicated in the event where it's the nth time, could be the third time to the ER, the first, second, 10th time to the ER, and the family is reacting. The son, the daughter, the family members, there could be multiple children, are trying to figure out, we just got the phone call, the ambulance is on the way, and we're headed to meet them. Sometimes it could be that they're with the family member. They might live cohabitating. The individual parent could live independently with a spouse. Could be they live in single. So we are able to help navigate that situation. We try our best to be able to understand what is happening. We try to anticipate what the needs are going to be. In many situations, if it's the first time, it could be they're having a situation that they're not really sure what they're going to do, so they've called 911, and the EMTs are on their way to assist. We don't typically get the call at that point because that would be something that is not necessarily a home care intervention. But we would get the phone call when they're at the hospital, the discharge planners, the social workers are starting to prepare for the next step. And the next step could be 3 days from now, it could be a day from now, it could be a week from now. But as we all know, in hospital situations, they do not keep patients long. They look for the next transition, the next movement where they're going to put them into a rehab center. They might hold them for a while. There might be a surgery involved. So, as an agency, executive home care is not about when you need us, it's about how do we help you navigate. I really like to be there as an advisor. I like to be there to help families understand what next looks like. And then, based on what information they're receiving from the hospital, the physicians, the nurses, the discharge planners, the social workers, what does that mean? And then, how do we help them navigate it? So, again, going back to the original question, it depends. It really could be the first episode, it could be the nth episode, but they're all different. Family members are in a different place each time something occurs.
Right. So family often dismiss changes. Oh, they're just getting older. But looking back, families often realize that the signs have been there for months. So who are, why is it being diagnosed? Oh, they're just getting older. Well, getting older means different things for everybody. So, but somehow they have to wrap their thoughts around it, why there are changes. But then they realize when things are getting really serious, then they realize, oh yeah, we've seen that sign before. Let me go get on to the next question. I think many adult children begin asking themselves, is this normal aging? Or is something really changing? Here again, it's all related. What are some of the little things families tell you that they've noticed first? What are they telling you?
Number is things are different in the family home. Things are maybe not always in the same place they were. The parent, father, mother, depending on who it is not acting like they used to. They've noticed that there might be something going on where they act slower, they move slower, they're seeing things different. They notice that things are not in the same places that they used to be. And that doesn't mean that the parent is developing a dementia symptom or developing a physical ailment change. It could be just that as they age, it's not as important to them to ensure it's in the same spot and taken care of. But those are definitely signs that family members should be aware of. We should start thinking about what does that potentially look like down the road. And if you're not familiar with those type of what ifs, it's time to
Mhm.
maybe share it with their doctor or ask a practitioner or just have a
Mm.
hard conversation with they themselves. Like, hey, mom, dad, what's different? I noticed this because they might actually understand something's changing in their own body and mind. They're just not willing to accept it. And acceptance becomes the first step in establishing safety. So we can always give some of that insight. We're almost a third party neutral person that has just seen it before. And those are where I really like to help because people are smart, people know their own self, and sometimes it just takes a conversation to bring to light where something's at. Now, in the situation we're talking about, there's been an event. As I said, it could be the first or it could be the nth event. And those are important to be able to observe and understand what that means.
You know, El, my kids wouldn't even know if I'm forgetting appointments or not taking my medication or if I eat poorly or if I'm losing weight. Adult children have their own lives. They have their own children, they have their own lives, they're busy, and my kids wouldn't know if I have unopened mail or unpaid bills. They just wouldn't know till they're really confronted with the situation. They just wouldn't know. I made some notes for myself on all of them. They wouldn't know because they're just not involved in my everyday living. They don't
Yeah,
know it. They don't know anything.
sure. And Marietta, one of the things that is very important from a family unity perspective is that as we age, whether we're the aging child or we're the aging parent, we have those conversations about what if. I run the agency with everything we do. I always like to say, so what? Right? So, what is the output of the activities we're doing? The way we answer the phone, the way we document our new care plans, the way we document and review existing care notes that come in. And those are situations that you could go on our website and read about what we do. You can Google anything and you'll get an output. To your point, it is important that your kids are potentially a second signer on your bank account. Your children know where your will is, if you have a will, what your living will, are you a POA designee? Because that becomes a way for a family member to not be involved, but to be able to help in the event something happens. A POA is nothing more than a power of attorney to act on behalf. When somebody passes away, there's a whole separate set of requirements that need to be put in place. And a POA is no longer an active function, right? Because you've passed. There's nothing to be the power of attorney for. So I say that because it is important as we age. And if you live in another country, another state, on the other side, whatever you are, having that conversation with your parents or your parents having that conversation with you is important. And I know nobody wants to give up their independence. It's actually a way to keep you independent because now you have somebody that can look out for you and keep you where you are. It doesn't matter whether you are living alone with somebody, but if you know that you've given the authority to somebody to keep track of it, as you stated, are you paying your bills correctly? Are you using a credit card? How protective is your assets every day? And those just become basic fundamental activities that if you put them in place previously, now it's just an observation task that has to go on. So if your children, son, daughter, multiple sons, multiple daughters, whatever the situation is, even stepchildren, they are available to help ensure you're safe. And safe has a big connotation to it, but being safe is your accounts aren't getting hacked, your bills are getting paid, your medications are being delivered if you take them, how you're administering medication each day, who's actually helping you. There's a sundry of ways you can ensure you're taking your medications correctly, but it's the so what, right? So we put this in place and now we know what to do.
Al, we're going through this. My my daughter's mother-in-law passed away a couple of months ago of cancer, and they live in Vermont. Now here we live in Connecticut. It's a 5-hour travel. So they were there a week ago, and it's very hard for my daughter because she has a relationship with her father, like she remembers him when she was little. So sometimes he can be very overpowering. So she tippy toes around him. So here she wants to help him. He lives now alone, and he's not the best of health, but she's very timid, overcautious to even ask him anything. She's afraid to set him off. It's not always easy for family members, for a son or a daughter, to start a conversation. Maybe sometimes it's easier a third party like yourself. Maybe it's easier. I don't know. But this is what we're going through right now. Yeah, they should really know everything. But she can't sit down with him and say, "Hey, let's really talk about everything. Let's talk about, when you really, really need help." She can't do it. It's an emotional thing,
Well,
you
and
know?
real situation that you speak of, because it is. When my mother became ill at 75 years old, an active realtor running her business, being out 7 days a week, doing what she loved, and becomes diagnosed with stage 4 brain cancer. She did not have all of her affairs in order. I mean, fortunately, she's still married to my dad and things
Hmm.
of that nature, and we were able to step in, but we did have to move very quickly. You have to know an attorney, you have to have somebody that's going to help sign your appropriate documentation to manage you as you continue to move through a diagnosis. And, it is difficult. Fortunately, not for our family. We were collaborative, but it is important that sometimes you have those conversations. And there are folks that can help do that. There are individuals that can help lay the land of what looks appropriate so that people feel like they're not giving up their authority, but they're having somebody assist them as they move through the process. And it is difficult. Some people are worried that the monetary value of their assets is going to be compromised, that there's now someone that could have access to their information that they don't choose to, even if it's a son or daughter. Those are very common situations. So, all I can ever say to anybody that asks me that question is, you're going to have to do what you think is right. And if the individual chooses to not want to take your advice or not feel that it's in their best interest, then you let it go as it may be. The issue becomes once you pass, if you don't have a destination of your assets and your wishes,
Hmm.
it goes into the big probate world. And the probate court system is set up to ensure all the potential steps are taken that will ensure the person's assets get distributed appropriately. But it becomes very labor intensive to manage those. And so I always like to say to people, you're not going to take it with you. You're not going to take it home. It's going to stay where it is. So as long as you're comfortable that there could be a long drawn out process and your wishes might not get completely met, then those are choices you make. But it is complicated. And I do say overall, family members are supportive. The individual, our clients, our client family members are going to do what's right by them. But it does get complicated, and it does get complicated amongst the siblings and the mannerism in which even some of the designed assets and choices get managed. So it is always good. It's always good to have someone that looks out for your health and welfare, someone that
Hmm.
looks out for your assets. And, some family members choose to give one child the responsibility of the assets, the other child responsibility for their health and welfare. Sometimes they co-manage it. And of like that, those are areas that as long as the family member, the client of ours made those choices, the individual should just accept it and carry them out for them because those are the right things to do.
Right. Now, families are spread out geographically. We already know that. Adult children are juggling many responsibilities. They often feel torn between parents and their own families. And I have talked to a couple of people, and one lady said, my mother is in care now. She has somebody coming in every single day. My mother's very demanding, and I never had a good, real good relationship with my mother, but I feel I'm taking care of her. I oversee everything. So what do we do when they're spread out geographically and it happens? They're all over the states. Some of them are overseas, and many of us we're still living on our own. We're in our 70s, 80s, some 90s. We're living on our own. Where do you come in?
Well, again, we're limited by the purpose of the agency, which is to help take care of the individual. I love when I get a phone call from a family member that says, and I can give you an actual story. So we have a situation where the neighbor went to visit. This is back at the holiday season. The neighbor went to check on, as she always did, the husband and wife. She happened to have a little bit of skills being a nurse and never intervened, never overstepped her role, but said, I think something has to be done for my husband and wife neighbor next door. So, that being said, she called our agency. She happened to find us online as a non-medical home care agency that provides personal care, all the activities of daily living support, and said, "Are you talk to me about what you would do?" And so, anyways, we went through the whole scenario. We talked about what we could help do. She said, I'm going to share your information with the son who lives in another state, south, and let him decide if he wants to pursue. So the good news is that actually makes you feel good, right? Because now you've been able to articulate what you do. You kind of get a sense of what's happening from a distance. The woman was being incredibly transparent about what is happening. And then ultimately, the son called and said, I'm really glad you called, you were able to take my call. I talked to the neighbor. This is the situation. We're moving my mother and father into a retirement community. They're adamant they're only going to go to one. There's a significant waiting list. So we need some help in the interim while an opening occurs for them to be moved into a community where they're going to have 24-hour support. It's not a nursing home, it's a regular assisted living center. So for us, we went in, we understood what our role was going to be. And really, it wasn't about all the personal care, it was more eyes on mom and dad because they could take care of themselves. They just needed some people 8 hours a day to help out.
Hmm.
Make sure that they were eating, make sure that they took their meds, make sure that they were moving safely. And to your point, they live far away, so they're not a drive over. The neighbor next door is not feeling now like they're becoming the parent's supervisor. They can still be their neighbor and friend. And it
Hmm.
worked out really well. The good news is we actually have a relationship with the community that they were moving to. So we were already talking to them about, hey, what do you think it's going to look like? This is what we're seeing. These are the observations of what we're able to convey. And it actually helped accelerate their move because there were some changes that the community was able to react to. And the waiting list for them, they went down, they waited their proper time, and we ultimately moved them in, which was really a nice place where the son did not have to feel like he wasn't doing his role. He actually did his role. He set up somebody to be there. The caregivers were able to step in, do the things that needed to happen, and ultimately they were safely moved into a place. They didn't end up tripping, falling, having a episode, and we did our job. We stepped away, and life went on for the family.
Right. People feel guilty. Adult children feel guilty whether they live nearby or far away, and one person cannot do everything alone. And adult children often blame themselves.
Oh, sure
But
they do. We all would blame
you know,
ourselves. And the reality is we all have lives and we all have responsibility. Now, still you can manage from afar and you're able to feel like you're doing your part. Now, yes, would it be better if you were close by and you could come in and stuff? But the good news is we took care of all of that for them. So they get to know the caregivers, they get to know the scenario, they get to communicate. We are able to share documentation. And, the one thing I always say when asked that question about how do you work with families far away is keep in mind if you're not the POA or you're not been given the health right supervision, then the family does have to say, yeah, it's fine. You can let my son or daughter know and things like that, because we do have to respect that under the HIPAA laws and the governance of what our agency operates under. So as long as we cross those barriers correctly and we align, the families are usually pretty darn good about what needs to happen and the level of information. And truthfully, what I find more so than not, it's not that they don't want them to know, they don't want to bother them. The bother is that they are
Exactly.
busy, and it's not
Exactly.
about, yeah. So the bother is something we like to help mediate pretty easily, and then
Yes.
understand what the communication level looks like, and then stick to it.
And you know what's real, Al? The fear of losing independence. And I went through this for 3 months, almost 3.5 months, where I had big time problems, chronic pains every single day, which affected my mobility to walk. And my kids were doing their thing. They knew mom wasn't feeling well, but they were busy. They were going to London to visit the granddaughter and all of this. And I was pretty much on my own, I have to say. And so I took action and I found the right doctor, and I've been working with that doctor. And the fear does come up. It's normal to get that, especially when you're very independent. You've been independent all your life.
Yep,
So
exactly.
allow me to move on to the next question.
Sure.
Um, the sometimes brother and sisters, they don't see the situation the same, and we're going through the same thing. They're all doing. It starts with the obituary, how to write the obituary. It's amazing. One thing's mom is fine, the other one is deeply worried, and the person doing most of the caregiving feels completely overwhelmed. How do families begin working through those differences? When you step in, Al, I know you're a problem solver, you're a big problem solver.
Question, Marietta. There's a an approach, and I like to say that I usually don't get the opportunity to meet all the family members at once. Usually there's one child that steps in and helping arrange care and managing the transition. And, you know, it's not my place to intervene and say, well, who else is involved and how else do we interact with them? But what I say is, as you're talking to your client, our approach at executive home care is that we like to bring everybody into the understanding of what we're here for. So, executive home care is going to be responsible for you. We have a very detailed care plan that we can make incredibly detailed if need be, but it follows the guidelines of our licensure by the state. And what I say to them as one of our intake forms is, who else do I want to put on this form so that we understand what their role is in your care? And 99% of the time, Marietta, I get everybody's name. I will also get some commentary about everybody. I'll get
Mhm.
some purpose of everybody, but somebody might want to get a copy of the invoice every 2 weeks when we bill. Somebody might be the emergency contact in the event that something happens. All three, four, whatever the number of siblings might all be emergency contacts. But what we say is we need somebody as the point. And the first point, obviously, is the client. And then from there, the client might say, but always call my son, always call Joe, or always call Mary, or don't bother anybody until we know what's going on, and I'll reach out to them effectively. So we would get that up front, and we really ensure that we know what the chain of communication needs to look like. We ask on intake what hospital you go to, who's your primary doctor, what pharmacy do you use, so that we always can help assist. Our caregivers will know that if there's a prescription, they can call. So that becomes something I always like to lay out right up front. And you're absolutely right. There are family members that say, don't bother calling my siblings. Well, that's fine, but I also need to understand what their role is in the care
Mhm.
of what we deliver. So we just kind of leave it at that. And then um, in the home, we have a an operating manual we leave, as I refer to it, and it's the care manual. It's what we're there doing. Our care plan is printed out. We have care notes that the caregivers leave. We have a communication log. So in the event there is any type of not hostility, but there's any tension between who thinks what is right, at least I know that the information's there. And I will say over time, I'll meet everybody. I know everybody involved. Um, because our concern is the client. If you don't get along with your brother and sister, and the brother and sister have different views and opinions, that's great. But at the end of
Hmm.
the day, we're there for the purpose that you asked us to. So that's kind of how I like to approach it. I don't really like to push on
Hmm.
why and the where. We come in at the point in time that there's a crisis. As we started this conversation at the beginning of this session, we come in because an event has happened, and that's why we're there, and that's what we're there to focus on. And some of the other issues just either work themselves out or they have to stay in the backdrop while we deliver care.
Right. So before we go to segment two, just a quick takeaway from this segment. Becoming a caregiver usually happens gradually, not overnight. Small changes are often the first signs that something is changing. Adult children often struggle with guilt because they're trying to balance many responsibilities. And the earlier families begin talking, the more choices they'll have. And start paying attention, start talking, and start learning about your options before you need them. That's why we have Al Criscolo. He is the president and the owner of Executive Home Care in Stratford, Connecticut. That's why we have these programs to educate the community. So, okay, Al, again, we still have a lot to cover. Let's go to segment two. Why waiting until a crisis makes everything harder? So most people think mom is doing fine. It's human nature to postpone difficult conversations. We know that. We've done it ourselves. We're not exempt from it. So no one likes to think about parents getting older because we don't get older and we don't die either. I'm trying to be a little jovial about it. And families are busy with their own lives. So they don't realize how quickly things can change. And we got to be prepared. Al, what are, when people can't wait until they're in the middle of a crisis before they start looking at their options. People have a plumber on hand, they have an electrician on hand, they're pretty much covered for everything. Why not for this? Why would I start looking for people when I'm sitting in the hospital? Why?
Marietta, it's because it's an area that nobody thinks is necessary because an event hasn't happened. And unfortunately, those events are never planned. What is planned is when somebody says, I've got to have a procedure. And so that's where they take the advice of their doctors, maybe the nurse practitioner, they take the advice of a family member that's gone through it before and says, hey, you're going to have that knee replacement. Guess what? You're not going to be running. Now, knee replacements is a good example of how quickly people do recover. But what I will tell you is every situation is different and every situation has a potential risk. People could end up with a blood clot. People could end up with an incision that didn't heal correctly. So what usually will happen is, and the good part about healthcare is it does have some stopgaps in place. Those individuals are typically on a Medicare program. They get some assistance. They go to rehab. Some don't go to rehab, but somebody's starting to talk to them about you might need somebody there to help you move, ambulate, transfer. You might need somebody to help you get a meal. You might need somebody to help you bathe and shower because you have just had a procedure. So those are a little bit easier to plan for. Um, but it because that's a scheduled event. Somebody having a heart attack, somebody slipping and falling, somebody dropping something on their body that hurts that then causes an injury. Those are unplanned, and so people don't necessarily think about that.
Yeah. How important is having time on your side? Because I imagine that the biggest things family lose during a crisis is time. So instead of calmly looking at different options, they feel pressure to make decisions immediately. Well, you have to make decisions immediately.
Well, every one of us knows when you go to a hospital, they're trying to get you out as quickly as they can.
Mm.
And they get you out as safely as they can, but the Medicare, the insurance providers all have very strict protocol that has to be followed. And so they move you. They move you to a rehab center. They're going to move you directly home. More and more hospitals are trying to send people home versus sending them to a rehab center. So time is not of the essence. I mean, time, you do not have a lot of time. You do not have preparation. Sometimes now you got to think about what does the house have, right? Most people, if they own a colonial, a two-floor house, do not have a bathroom with a shower on the first floor. Those people that have ranches, they do. People that have raised ranches also have a similar benefit, but they've got stairs. So those are all things that weigh into how quickly can I get out and get home safely, because you might have to do modifications to the home. And modifications, albeit they can get done, they're pricey, they're costly, and they require time. And so in those situations, agencies like myself, we come in with contingency plans, right? How are we going to effectively help? Because stairs might not be an option. There might not be a shower on the first floor. So what do we offer that can help solution those type of situations? And those are where we get involved very quickly, and we say, hey, this is what we can do. And then families think about and consider. The other option is, if those going home is not the right solution, can they go with a family member and then have support at the son, daughter's house, brother, sister's house, whatever those available options are, so that they can get out, they can get rehabbed, and then they can move back into their own home.
And you can navigate. You actually, that's what your job is. You navigate uh, from from the beginning to the end while
That's
they're
our
in
job.
transit, because let's just say they don't have a bathroom because of the home they're living and so forth. You're actually an architect. You become the architect.
We work on how to create a safe environment
Hmm.
that also feels comfortable to the client. You know, there are commodes you can put in the bedroom, there's commodes you can put in the living room. You can create a scenario where they might not be able to get to the bathroom from their bedroom or from where the interim bed is being placed while they recover. So you do have to come up with some other options. And when you get a caregiver from our agency, the care plan might speak very clearly to the commode is used when needed and it's removed until it's needed, so that families don't feel like there's constant unsettledness in their home. And that's typically where families feel comfortable, like, okay, so now someone's going to be here to help do all those things that I used to do and still make me feel like I've got a level of independence, but I also have a level of safety that I'm not going to stumble, trip, fall.
Right. Now, if someone is watching today and their parents are doing well, what would you encourage them to do now before there's ever a phone call from the hospital? What would you say, Al?
The first thing you want to do is say, is the house in a condition that could accommodate a change in their behavior? So you look at them, they might only use a cane, they might not use any support, but there's a bunch of little area throw rugs. Get them out of the way. Get them out of the way, because those have almost 100% risk of tripping and falling. Look at where they're putting their food items. Are they using a step stool to get to the upper shelves? bring all that stuff down. Make it an event where they don't have to go up there anymore and it hasn't changed their life. In the bathroom, are there grab bars at all? Is there a threshold getting into the bathroom that they could potentially trip on? These are just fundamental, basic things to think about. Where is the toilet in relationship to their ability to sit and not be obstructing how they're going to get up? Do they have a way to help themselves up off the toilet
Hmm.
if and down on the toilet? Because, typically if you have weaker legs, sitting down is difficult. So start to prepare for the what ifs. And we do offer some of that as you go through and you navigate changes in behavior. There's 98-year-old men and women that don't use much more than a cane. There are 65-year-old, 62-year-old men and women that are in wheelchairs. So you have to think about what does that look like? And if you have questions on that, that's why I'm here. Like those are
Hmm.
the things that I would love someone to call me up and say, you know, my mom and dad have 8 stairs getting up from the driveway to the front door. I'm starting to wonder what we do differently because they're not going out as often, right? They're afraid to walk down those stairs every other day to go to the grocery store. They're only going down when they go to the doctor. So you already are starting to get basic signs that things are changing, and you should start reacting to those.
Right. Now, we have learned here in this segment, emergency forces families to make important decisions under pressure. We don't want any pressure. Time is one of the greatest advantages a family can have. And talking before a crisis reduces confusion and family conflict. And I say you don't have to need home care today to begin learning about it and having a conversation with Al, because just what you just covered, Al, this is so important. People just don't, they're so overwhelmed because of the situation that now is that they're dealing with. We need experts like you to come in and say, okay, we can do this way, we can do that another way. This is the architect. This is your job, and you're doing a great job with that because we don't think about that, and we don't know. We don't know what's on the market, what solutions we can have. That's why people should talk to you. And I'm blending in right now your telephone number as well. So don't wait till till you're in the crisis. So let's go to segment three. We still have a lot to cover. Choosing a home care agency, and I think I let you start that off because that we've covered that in many, many of our segments already. So
What I would say first, and I'm obviously
quick.
being a little bit biased about that, is
Mhm.
you need an agency that's responsive. So, executive home care, we do not have an answering service. We answer the calls 24/7. Our phone system is actually tied to apps on our phones. And that's for a lot of reasons. First off, is accessibility. If you call, you're not calling for any other reason than you've got a situation going on. And I expect that if you call, I'm going to take that call and understand what I can do to help solve it. You might be an existing client, an existing family member, or you might be somebody brand new, like, hey, my mom is in the hospital and they told me to start looking for help. Because as you know, Marietta, the country, everybody has choices. And those choices start with your options and your rights to select and choose your own healthcare provider. So at Executive Home Care, we follow the same thing. We get many referrals just from experience, people, referrals, references, things like that. But at the end of the day, you have the right to choose your caregiver. And obviously, I hope most people would choose Executive Home Care as your option because We are responsive. We do answer the phone 24/7. I do take on call because it's important to me. Not that I don't trust our team or our caregivers, but I want to hear why you're calling and what you're calling for. Caregivers run late, they get tied up. Family members have issues going on that they want to talk about. They're working all day long. They don't have time to get back to you. And it's important to me that if you call, I'm available to take those calls from you. So when you choose a provider, those are the things that I look for,
Hmm.
that I expect to see in place. And if I don't, then I ask the question, why? Why don't you answer the phones? Or what are your solutions when you have a problem? And we get questions all the time. People are very smart, they're well engaged, they have lots of experience because everybody has a friend. Everybody's had somebody that's had home care. And the differentiator from executive is yes, we've had many of those clients, but I say the same thing as I say on every level. It's all brand new situation every time an event happens. And I want to make sure I understand what you need, how often you need it, and I can advise you on you might be looking for more care than you need, or you might be needing less care than you think. And that's what I want to be advising you on. I always tell people when you work with executive home care, it's a fluid care plan. We can change it as often as needed, we can change it as often as you want. And you can try to be independent. And if that doesn't work out, the only thing I always advise is don't wait till you get a hurt or another episode happens. Think about what else you can do. And so when you choose an agency, those are the things that I really recommend strongly. We run background checks on every caregiver. Every caregiver at Executive Home Care is an employee. We don't use contractors. They all get vetted through a Homeland Security federal background review to make sure that they're actually allowed to work. They have no reasons that the federal government does not let them be in this country. They all have to pass a background check that we run and pay for. We look for CNAs predominantly in our workforce. CNAs are great because they've got an extended background medically. Our home health aides are great because they've got an extensive ability to understand the humanistic part of it. Not that CNAs don't, but CNAs have the have higher medical skill training, right? They know
Hmm.
how to use a Hoyer. They understand what transfers look like. They know what a slide board is. They understand how because they're tested, right? They're certified nurses. They have a license that I like to be able to know that has been given to them because they've met a higher level of training. So those are the things that I believe are really important when you select an agency. But I also am very transparent that there's really great agencies out there. There's a couple thousand of them licensed plus in the, in Connecticut. But you also have to feel confident and comfortable with that person. We go out,
Right.
that to me is important. We go out, we meet you. I meet literally every client before we start services. Sometimes we don't. Sometimes they've had us in the past, so they just want us to start. But I will meet and introduce every caregiver to a family member. And
Because
sometimes that's a lot.
right. It has to be the right match between the caregiver and the client. And I know you watch very carefully for that. Just talk a little bit about that, please.
It, this is what we say, and I'm not the only one that says it. Most quality agencies say is you need care to start tomorrow. I work really hard when you give me 3, 4 days, 2, 3 weeks, right? There's family members that call and say, my mom's at the X rehab center. They told me I should start looking for home care. They're going to need 12 hours a day. They're going to need a live in. Um, we've got family members that are available on weekends, so we're not going to need it. We just need Monday through Friday coverage. And so we start having that conversation. And, I immediately start looking for who the caregivers will be. Our team, we know who's coming off schedule. We know who's a brand new hire coming on. And we start to look for that because we do tell families and clients up front, we might start with caregiver X, but once we learn a little more about you, we might swap them out, or you might not be a good fit. So that's really important to me. And I have no problem ever
Mm-hmm.
swapping out a caregiver um, because a family member is not comfortable. And sometimes our caregivers aren't comfortable.
Right. And another thing that comes to mind, let's say a family starts with just a few hours of care each week, right? But 6 months later, mom needs more hours. The needs have changed. Now, how important is it to choose an agency that can grow with the family needs? How important is that?
Really important. And it's very much what I do as an agency because clients change very quickly. And if you have a situation where you know that there's a higher level of skill or there's a potential personality conflict, you get in front of it and you start preparing for what that looks like. The reality comes down to, Mariette, is that a good quality caregiver bonds with their family and the family bonds with them and they learn together. And that's really important as we develop the relationship because, as you said, there could be signs and symptoms that nobody was even aware of. And that's what our caregivers are there for. They document it, they observe it, and they actually react to what does that mean? And what should I be thinking about or reporting back to the office or reporting back to the family?
Right. Al, I have a personal question that I'd like to ask you because you have helped so many families over the years. If there was one piece of advice you would give someone who's beginning to look for a home care agency, what would it be?
Well, I would say first trust, but that's a hard thing to do initially.
Mhm.
You have to feel confident and comfortable with whoever you're talking to, that they're not just trying to sell you, they're trying to partner with you. And that is really my objective in every client we take on. We're a partnership, our caregivers are partners, and we're not here just to be a body working for a client. We're here to be a partner in the care delivery of what needs to happen for you every day. So to me, it's really important that we don't necessarily just deliver care. We deliver quality care that's appropriate for the situation. And what I mean by that is if what we're doing isn't making you better or making you safer, then I need to be aware of that because that's why we write a care plan. Our care plan is there to help somebody regain strength, confidence, and be able to improve their life to the best baseline recovery they can get. And that's what our objective is every.
Now, the takeaway from this is look beyond the price. Trust, communication, and compassion matter. And a good caregiver client match is essential. Choose an agency that can grow with your family's changing needs. So let's get to segment four. We have about 6 minutes left in our show. And segment four is the greatest gift you can give to your family. So, Al, when you hear the word gift, we usually think about birthdays and anniversaries or holidays, but I think one of the greatest gifts we can give our family isn't something we buy, it's something much deeper. What does that gift look like to you? The gift of planning ahead.
The gift,
That's one thing that came to my mind when I put
it's
this question together.
it's planning, but it's also thinking of the whole event
Hmm.
because sometimes the event is not recovery, Marietta. Sometimes the event is end of life. Clients are moved into hospice programs. Clients have already advanced and where they're trying to just remain comfortable. So those are things that we look at very closely because sometimes family members want something that the client doesn't. And that's important to understand. And just remember that there's an objective that might not be feasible across families, but it's important that you deliver what's important to the client. So we work really hard on that, from meeting objectives that satisfy both. Family members have very strong opinions and views and objectives, and sometimes it doesn't always necessarily align with the client, but we navigate that, and our caregivers are trained and they understand, those tough conversations have to happen, but they have to happen appropriately.
Exactly, exactly. That goes right into my question number two. Many parents tell their children, I don't want to be a burden. So we know they mean that from the heart. So how can families help mom and dad without making them feel like they're losing independence? This is really great advice now for adult children. And it's reaching my heart too. Um, I want to be listened to, what my wishes are. Um, and I want to be included in the decision and making decisions. That's what I said in our last show. I like to have my daughter take over, but I want to be involved in the decision making. And there are many other areas too. What do you say, Al?
So I have this conversation many times with many clients because I do talk to our caregivers. I'm very engaged. I'm very participative. Um,
Hmm.
and sometimes family members are asking for things that the client themselves don't want to do. They might be comfortable sitting on the couch 6 hours at a time, or they might be comfortable taking a nap in the afternoon versus going outside, even though it's a beautiful day. It might be a beautiful day, but they don't care. They're not interested in that. So, what I tend to do to be the voice of the client, but also the voice of reason with family members is listen, I, I want to hear all of the input, but at the end of the day, we really need to respect the client. And we'll do whatever you're asking and we'll try, but we do need to listen to the client because that is our responsibility, irrespective of who's paying for the services. It is important that we respect that because if we don't, then the client looks at us like, why are you telling me to do something I don't want to do? So I've had that pushed back on me many, many times. And I just, I try to be as reasonable as possible because I do need to support the care plan and I do need to support the caregivers. And families will be like, let Al know what you want. Like they'll actually bring that up and make it part of the conversation when we have our reassessments, when we have drop in checkpoints, things of that nature. So I know I'm heard. And listen, there are some people that don't really care what I'm saying, but they do understand and appreciate our objective and our responsibility. So that would be my little bit longer answer than, it depends because it is important. So
And will have the last word. We have 2 minutes left. Um, every family watching today, remembered, if they just remember one thing from our conversation, what would you hope that would be? What would you hope that would be?
respect the client's wishes and objectives and use your history as the family member to work with that individual. Because as I said, we come in at a point in time, we didn't grow up, we weren't raised by that individual. So you need to help us, help you, but always remember respect the person that's getting the care because they're the one ultimately going.
Oh, and I hope, meaning we hoped, that today's program has given you something even more valuable than information. We hope it's given you a place to start. There's never any pressure, only a conversation. Sometimes one conversation can make all the difference. And for more information or to schedule a consultation, please contact us, and the number will be right on the screen. We would be honored to answer your questions and help you explore your options. For Al Criscolo, I'm Mariette Camera. Thank you for joining us for Care Insight.